Most people think heart failure looks like a Hollywood movie, a man clutching his chest, gasping for air, collapsing in a dramatic scene. But in the real world, the early signs are much quieter, much more subtle. It's not a sudden explosion. It's like an engine that is slowly losing power. You might not notice the loss of horsepower day to day, but eventually you realize you can't get up that hill anymore. These whispers of the heart are happening to millions of people right now, and because they don't scream for attention, they are ignored until it's often too late to reverse the damage. I'm Dr. Rachel Rayan, and today I want to walk you through the 7 early warning signs of heart failure that are incredibly easy to dismiss as just getting older or being out of shape. Recognizing just one of these could save your life or the life of someone you love. If you find this information helpful, please take a moment to hit that subscribe button. It helps us get this vital health information to the people who need it most. Before we dive in, just a quick reminder that while I am a doctor, this video is for educational purposes. I've listed the trusted medical sources we used, like the American Heart Association and the European Society of Cardiology, in the description below so you can verify everything for yourself. And let's start with something you might be doing every single night without even realizing why. I call it the pillow prop. This is technically known as orthopnea. Have you noticed that you can't sleep flat anymore? Maybe you started using 2 pillows instead of one, or you've migrated to the recliner because it's better for your back. Here is what is actually happening. When you stand up, gravity pulls fluid down into your legs, but when you lie flat, all that fluid rushes back to your chest. If your heart is weak, it can't handle that extra volume, and the fluid backs up into your lungs, making you feel like you're drowning. If you need to prop yourself up just to breathe at night, that is not a back problem. That is a heart problem. Next up is a sound that often gets dismissed as allergies or a lingering cold, the nighttime cough. In medicine, we sometimes call this cardiac asthma, but it has nothing to do with asthma. This cough is usually dry hacking and happens when you are trying to sleep. Why? Because as that fluid we just talked about starts to irritate the small airways in your lungs, your body tries to cough it out. If you are coughing up pink, frothy sputum, that is a 911 emergency. That means the fluid has flooded your lungs. But in the early stages, it's just a nagging cough that won't go away, especially when you lie down. If your cold has lasted for months, listen to your lungs. Now, let's talk about your legs. Have you ever taken off your socks at the end of the day and seen a deep indentation, a ring around your ankle that stays there for minutes? That is called pitting edema. It's not just water retention from a salty meal, it's a sign that your heart isn't pumping hard enough to get the blood all the way back up from your feet against gravity. The blood pools in your veins, pressure builds up, and fluid leaks out into the tissues. It might not hurt, but it's a red flag. If your shoes feel tight in the evening but fine in the morning, your heart might be struggling to manage the fluid in your body. Sign number 4 is a feeling of heaviness that is hard to explain to people who haven't felt it. We call it the metabolic drain or simply profound fatigue. I'm not talking about being sleepy after a long day. I'm talking about feeling like your limbs are made of lead. Patients often tell me, "Doctor, I feel like I'm walking through quicksand." This happens because your heart, in its weakened state, has to prioritize where to send blood. It chooses the brain and the heart itself, leaving your muscles starving for oxygen. When you try to walk or carry groceries, your muscles literally don't have the fuel they need. So they tire out almost instantly. If you are exhausted after doing things that used to be easy, don't just call it aging. This next one surprises a lot of my patients because they think it's a stomach issue. It's the full stomach or early satiety. You sit down to eat a normal dinner, but after just a few bites, you feel uncomfortably full, bloated, or even nauseous. You might even lose your appetite entirely. This isn't gastritis, it's congestion. Just like fluid backs up into your legs, it can back up into your liver and your intestines, and your gut wall gets swollen with fluid, which slows down digestion and leaves no room for food. If you are losing weight because you just can't eat, but your belly looks swollen, and that is a classic sign of right-sided heart failure. Number six is one we often blame on senior moments, but it can be much more serious. The fog, confusion, memory, loss, or just feeling like you aren't sharp. Your brain uses 20% of your body's oxygen. If your heart can't pump enough blood, your brain is the first organ to complain. You might find yourself forgetting mid-sentence what you were saying or feeling disoriented in familiar places. In elderly patients, sometimes this confusion is the only sign they show. It's not necessarily dementia, it could be a perfusion issue. The good news is, unlike dementia, this brain fog often clears up once we get the heart pumping better. Finally, sign number seven happens right in your chest, and it can be terrifying. The gallop. You're sitting on the couch doing nothing, and suddenly your heart starts racing, pounding, or skipping beats. This is your body's emergency backup system kicking in because your heart is pumping less blood with each beat. Your brain sends a surge of adrenaline to the heart, screaming, "Beat faster." We need more flow. It's a compensatory mechanism, but it's exhausting for an already sick heart. If you feel your heart racing when you are resting, it's trying to tell you it is working overtime just to keep up. If you recognize these signs in yourself or someone you love, please don't panic, but do take action. Heart failure is a serious diagnosis, but it is also a manageable one. We have incredible medications and treatments today that can strengthen the heart and help you live a long, full life, but they only work if we catch it. Don't ignore the whispers. Make that appointment. Talk to your doctor and mention these specific signs. It's the most empowering thing you can do for your health. Thanks for watching, and be sure to check the description for the full list of medical sources we used to create this video. Stay healthy, and I'll see you in the next one.